Welcome to the Piedmont Technical College Health Science and Nursing Information Session. If you are planning to enter a healthcare-related program at PTC, this session is required, with only 3 exceptions. Students who are currently licensed practical nurses and are returning to college to obtain their associate degree in nursing through our transition nursing program do not need to complete this session. A different session is required and can be found at www.ptc.edu/transition. The second exception is for any student who plans to enter a health science transfer program, sometimes also called the 1+1 program. These students take their general education courses at PTC with the clinical courses to follow at Greenville Tech. This program requires you to attend a specific session at Greenville Tech, and more information can be obtained from the program coordinator here at PTC. The final exception pertains to students planning to complete the Pharmacy Technology program. Students planning to enter that program need not complete this session, but should meet with an advisor to determine course scheduling plans. All other healthcare majors must complete this health science and nursing information session and submit the post-session quiz at the end to confirm it has been completed. Please note, the programs discussed in this session may occasionally change their requirements, so be sure to check the website regularly to stay up to date. It is your responsibility to know your program's current entry requirements, policies, and other related information. What is your motivation for choosing a career in healthcare? While many of these careers provide a steady income, you must consider more than this when deciding what work you will do for the rest of your life. The best healthcare providers have 2 qualities: compassion for others and a passion for wellness and good health. If you truly wish to help others be well because you care for them, then you will be fulfilled by a career in a health field. It is important to do research about these careers to understand the responsibilities involved and the working conditions you will face. Television shows and movies can portray these careers as glamorous, but they are quite the opposite. The PTC website is a good place to start your research. We recommend that you look at your selected program's individual web page and also check out the career tracks portion of the website. You may also wish to speak to someone working in the career field you are considering. Most of us spend 30 to 40 years of our lives working, so it is important to select a career that will provide you job satisfaction. Let's talk about how the application process works for these majors. It might be easiest to think of these programs being divided into 2 parts. The first part of your journey is spent meeting what are called program-ready requirements. These requirements include completing certain general education classes with a grade of C or better, meeting certain requirements about your grade point average, and some programs require students to take and pass certain tests. Each program's program-ready requirements are different. During this first part of the journey, you are considered a pre-nursing, pre-cardiovascular, pre-veterinary student, and so on, depending on the major you are looking to enter. Once a student has met the program-ready requirements for the program they've selected, he or she may then apply to enter the second part of the program, the clinical portion. Once a student applies and is accepted into the second part of the program, they change from being a pre-student to being an actual radiology student or surgical tech major or practical nursing major or whatever major they've chosen. Please note that PTC does not actually use a waitlist process to accept students into these programs. However, most students will wait to enter their chosen program. This is simply because each program only has a certain number of spaces available. There are 2 ways these available spots in the programs are awarded: by priority date or by merit points. We will discuss both ways in more detail shortly. Students who have met all the program-ready requirements for their program of study may submit an application to enter the program during the published application periods. Students may apply to enter only one program and may submit only one application per application period. Students must carefully read the application instructions to make sure the first application he or she submits is correctly completed, since any additional applications submitted by the student during that period would be discarded. The Associate Degree Nursing program accepts only a merit application, and the certificate programs accept only program-ready applications. All other health-related programs accept both. Students must decide when they apply if they are submitting a program-ready or merit application. Once each application is reviewed for eligibility, all applicants will receive notification by postal mail telling them if they're accepted into their chosen program. The applications are not kept on file after the programs are filled for that application period. Students who are not accepted into the program must reapply in order to be considered for entry in the future. Let's look at each of the application types. The Program Ready application is designed to accept students into the clinical program based on their priority date, which is the date on record at the college that the student first indicated they were pursuing that particular program. For example, if a student indicated they wished to track for the respiratory care program when they submitted their application for admission to PTC, and they did not change their mind after that, their priority date for the respiratory program would be the date they applied to enter PTC. If they changed majors and indicated they wished to track for a specific health-related program, the date they changed their major would be the priority date. In other words, the Program Ready application accepts students based on who has been tracking to enter that particular program the longest at PTC. Students that are tracking to enter a health-related major should think very carefully before changing his or her major, since changing the major changes the priority date and can add more time to the length of time the student has to wait to enter a program. Students are encouraged to stay active with the college in order to maintain his or her priority date. To keep your account active with PTC, you must enroll at classes at PTC, or, if you're program ready, submit a program ready or merit application during each application period. The merit application benefits students with exceptionally strong academic performance, allowing them to enter based on academic results rather than time. The Associate Degree Nursing or ADN program accepts all students by merit only and has its own unique application. All other associate degree and diploma healthcare programs accept up to 1/2 of their students by merit. Merit applications are based on earning points toward entry, meaning that students who submit a merit application are competing with other merit applicants for the available merit spots. The students with the highest number of verified merit points are selected. If a student submits a merit application but does not have enough merit points to be selected, his or her application is then grouped with the Program Ready applicants, and they are then evaluated for entry based on their priority date. As students work toward program entry, it is recommended that they track their progress and potential points toward entry. Application worksheets for each major that accepts merit applications are available online, so students may use them to calculate their points for their selected program. Some programs require specific testing as one of the program entry requirements. The Hobbit is a test used for determining math and reading skills of students as they prepare to enter their clinical programs. Hobbit stands for Health Occupations Basic Entrance Test. Only certain health-related programs require students to take the Hobbit. Work Keys is a test used as a program-ready requirement for certain programs. It consists of 3 sections: math, reading, and locating information. Check the website for more information about both tests, testing locations and times, as well as information about signing up for a testing spot. Your program's webpage is a good place to start to determine if your program requires specific test scores to enter. There is a fee for both tests. Do not assume that if you meet the minimum requirements for your program that you will immediately be granted entry. Each program has limited enrollment and can only accept a certain number of students each time. Computer and technical courses expire after 8 years. AHS 102, Medical Terminology, expires after 5 years unless you've been continuously enrolled at the college since completing the course. The remaining general education courses noted for health-related programs do not have a time limit. All courses noted for each program must be completed with a final grade of C or better. Students may take general education courses multiple times in order to obtain the needed grade. but there may be financial aid repercussions when repeating a course. In order to apply for program entry, students must be in good academic standing with the college. To be in good academic standing means the student's overall PTC grade point average must be 2.0 or better. Refer to DegreeWorks to see your overall PTC GPA. Students must also meet specific program-ready GPA requirements to apply. Program-ready GPA is a GPA that is calculated using only the program-ready courses for the specific program of study. A student's program-ready GPA can also be found in DegreeWorks, unless the student is using program-ready courses transferred from another college or university. In that case, the student must do the program-ready GPA calculation, since the program-ready GPA given in DegreeWorks does not include courses taken elsewhere. Once a student has determined the grades earned in the program-ready courses, both at PTC and those taken at other institutions, a handy tool called the Program-Ready GPA Calculator is available on the website. Just type in the letter grade for each class, click on the Calculate button, and your Program-Ready GPA will be displayed. Your overall Program-Ready GPA must be at least 2.5 or 2.0 depending on your program of study. Your program's webpage will tell you the specific program-ready GPA requirements. When program applications are received, every application will be reviewed for eligibility, meaning each applicant's qualifications will be confirmed by checking official PTC records. We check each applicant's overall GPA, program-ready GPA, attempts, courses completed, test scores if the program requires specific testing, and academic standing. Each applicant's official GED report or high school transcript must also be on file with the college before the end of the application period in order to be granted entry. For students using transfer courses for program acceptance, the official college transcripts must be on file for the students to be considered eligible. And a required test scores such as Hobbit or Work Keys must be on file before the application deadline. It is very important that applicants keep their contact information current with the college so notification can be made regarding program acceptance. Once you enter your program, there are policies which must be observed. One such policy deals with program attempts. This policy specifies how many times a student can repeat courses within his or her program. Students are permitted 2 program attempts. Limiting the number of attempts in the program protects the safety of patients, the reputation of PTC, and the education of our students. If a student needs multiple attempts to successfully complete a program, one would question whether that student can provide safe, quality patient care, and in healthcare, mistakes can cost lives. When you enter your program, be sure that you understand the attempts policy. The age requirement for the clinical programs is 18, and all students enrolled in clinical programs must be in adequate physical and mental condition as defined by the PTC Physical and Mental Standards Chart. As in many careers, healthcare workers must possess certain physical and mental abilities to complete needed tasks. Please refer to your program's webpage and click on the link for the chart to review it and determine which abilities are required for your program and the typical amount of time they are needed in the clinical setting. At the time of program entry, each student must submit documented evidence of immunizations, including hepatitis B, and annual tuberculosis tests are required. Students will receive specific instructions about submitting these documents once accepted to the program. Policy also states that students who will be providing direct patient care must pass a criminal background check that goes back 7 years. Each clinical facility has the right to deny a student access to their site based on the results of the criminal background check. If a clinical facility refuses a student entrance, the student may be dismissed from the program due to the inability to complete the clinical requirements. If you have prior criminal convictions, you are encouraged to work immediately toward having your record expunged. See the information about pardon versus expungement on the website for clarification. The best way to avoid problems is to have a clear record. Once accepted into the program, the student will be required to pay a fee for the background check. The background check is done for the college by a third-party contractor with no relationship to the college. Another policy covers drug screening of students in a program. Once accepted into your program, you will be required to undergo a drug screen, and a fee is required to pay for the screening. A positive drug screen with evidence of drug abuse will be grounds for dismissal from the program, and it will count as an attempt. After 1 year, the student may seek to be readmitted to the program. The drug testing is also processed by a third-party contractor. What happens once a student is accepted for entry into a health science or nursing program? There are essentially 2 meetings each student must attend. The first meeting is a program acceptance meeting. At this meeting, the student will be provided overall information about program admission policies and requirements, as well as instructions about needed health assessments, immunizations, and other requirements. Students who attend this meeting must submit a non-refundable, non-transferable deposit to hold their seat in the program. A second meeting is also required, the program orientation. Accepted students must attend program orientation because detailed information about specific course and clinical requirements is provided. As we near the end of this presentation, let's look at some frequently asked questions. Question: can I work while I am enrolled in a health science or nursing program? Answer: yes, but we encourage students to carefully consider the unique challenges of a nursing or health science program. Many of these programs are equivalent to a full-time job. Working severely reduced hours or not working at all is recommended. Individual programs will have additional guidelines discussed at orientation once you are accepted. Question: what will I need to do about transportation to clinical locations? And what about childcare? Answer: you must have reliable transportation and a valid driver's license. You will likely have to attend clinical training in all 7 counties of Piedmont Tech's service area. Clinical courses may require evening and/or weekend hours. It is very important to attend all classes, labs, and clinical rotations, so carpooling is not a practical option. Also, students who are parents need a backup plan for childcare in the event of illness or emergency, and be sure to have a backup plan for your backup plan in case your first option falls through. Question: what costs are there in addition to tuition for nursing and health science programs? Answer: upon entry to the programs, additional costs vary, but may include higher book costs, supplies, uniforms, testing fees, background check and drug screening fees, professional membership fees, malpractice insurance, health assessment and immunizations, and much more. Please note this is extremely important. Start saving now for the expenses of your program. Do not assume that financial aid or other resources will automatically pay for these expenses. Question: how can I get more information about healthcare related fields? Answer: the Career Tracks page on the PTC website is an online guide that provides career information for students to learn more about their field of interest and the job market. It reflects the current career statistics for Piedmont Technical College graduates. Go to the web address noted on the slide. Students who are unsure if a career in healthcare is a good fit for them may wish to meet with a career counselor to identify careers that best match their interests, values, abilities, and personalities. This concludes the Health Science and Nursing Information session. You must complete just 2 more easy steps to officially fulfill the information session requirement. When you exit this video, on the web page you will see several links which will take you to fact sheets for each individual health science and nursing program. Be sure to thoroughly review the fact sheet for your intended major so you will know your program's specific requirements, how many students are accepted into the program, when they are accepted, length of the program, and so on. You may wish to print the fact sheet for your reference. It is ultimately the student's responsibility to know and stay updated on his or her program's requirements. Once you have thoroughly reviewed the fact sheet for your major, you will need to complete step number 3, submitting the post-session quiz and verification form. Submitting this allows us to ensure you understood the material presented and provides the information needed to award you official credit for completing this session. Feel free to return to this online session and the fact sheets in the future to review them, or you may speak with your advisor if you have questions. Thank you for completing this session and best wishes for much success in your future healthcare career.